Why should people consider coming to Siteman Cancer Center to get their cancer care? What we have is every kind of specialist for every kind of problem, providing a solution, whatever solution is needed. And it's all done in a comprehensive manner, in a manner where the physicians are all communicating with each other regularly. There are a lot of thoughtful conversations that are happening that patients are not even aware of about their care, and it's really individualized. Every single patient gets this kind of individual attention when they come here, and I think that that's very important. Naturally, it's very scary to be diagnosed with any kind of brain tumor or lesion, and many times by the time a patient walks into my office, they may be having some side effects as a result of whatever tumor or lesion they have. Sometimes I'm very fortunate. I can tell them, you know what? You have some kind of tumor or lesion, but this is totally benign. It's nothing that you have to worry about. It's not going to change your life. But many times what I have to tell patients is, how is this tumor going to change your life? And I think about, how can I take this complicated problem that a person has and really distill it down into simpler terms and then provide solutions. And so that's the way that I think about it. And I want patients to leave my office feeling reassured that I've thought about their problem, that I've explained their problem to them, and that we have a solution, we have a way to move forward. 10, 20, 30 years ago, we would be able to maybe tell that a person has a problem and maybe even be able to give great detail about how that problem, if left untreated, is going to impact their lives. But I think that more recently, what we've been able to do is not just be able to tell patients, oh, you have this terrible problem, but also to say, well, you have this terrible problem, and now we have this solution. And I think now more than ever, physicians are incredibly well trained. They spend more and more time training and subspecializing. And I think that that's because we're doing more and more complex things. So we've been dealing with different kinds of cancers for many, many years. And I think sometimes when you zoom out and you try to take a look at the sort of global picture of where are we with treating these cancers, sometimes people can feel very sad that we haven't cured all of these cancers that are out there that we've known about for 50 or 60 years. But when I think about it, what I actually think about is the fact that maybe 10, 20, 30 years ago, we were telling patients that we have no surgical options, we have no medical options, we have nothing for you, and this cancer or whatever tumor you have is just gonna run its course. And now we have many more options. We have so many tools, not just for diagnosis, but also for effective treatment of patients. And I think that as we continue to dive deeper and deeper into understanding all of these tumors in the lab and elsewhere, we're going to, in the future, come up with even more options to treat all of these tumors. The mission of the Brain Tumor Center is to really advance the care that patients are receiving. And so I have a lab where we investigate the tumors that I treat in the operating room down to this molecular and cellular level in the Brain Tumor Center. And what we're finding in medicine as we learn more and more about these tumors is that every single patient's tumor is a little bit different. It's very unique to that patient, down to the molecular and cellular level. And so where medicine is going in the future is towards this idea of every single patient receiving a plan of care and treatment that is very personalized to them. And the Brain Tumor Center helps us make those plans. It helps us discover what is unique about this person's tumor, and then it gives us treatment options that give us the best possible chance of curing their problem. And that's really what it's about. Not just delivering high quality care through Siteman Cancer Center, but then partnering with things like the Brain Tumor Center, the Pituitary Center, and these other areas where we can investigate and where we can push the bounds so that somebody comes in to see us, we know they have a problem, but we take their tumor, we dig deep into it, and we start to answer questions like, well, why did this tumor even come about? How do we stop this from happening again? How do we prevent it from coming back after we remove it? And so it's really a two-part thing. We need to be able to treat patients now, but then we need to be able to make it so that when we treat the same kind of patient in the future, it's better than whatever we're doing right now. And I think that that's really important. So the Pituitary Center is where we treat patients with any kind of problem related to the pituitary gland. And the pituitary gland is this really important structure. It's in the middle part of the brain, in between the eyes, kind of deep within your head. And it produces a lot of hormones that we need to function normally every day. It makes cortisol, which is your stress hormone, but it also makes all of the pregnancy hormones, which allows women to go on to have a successful pregnancy, to breastfeed their children afterwards. And so this is a very important gland, And sometimes patients have tumors or other issues around this, and what we need is a team who can treat any of these problems. They can treat problems related to hormone imbalances, and that's the endocrinology team. But then when there's some kind of tumor or lesion there, they can get to the tumor and take it out and relieve any kind of pressure or damage to the pituitary gland. And so the mission of the Pituitary Center is to provide treatment options to any patient who has any kind of pituitary-related problem. And what we want to do is not just provide the standard treatment options, but also provide treatment options that we didn't have in the past and continue to advance those options. And I think increasingly, as we look towards the future, we're going to have more and more of those solutions. We're going to be able to do better surgeries. We're going to be able to do surgeries for more aggressive and more complicated lesions. And then on top of that, we're going to have treatments that are available to treat more difficult problems. So it's not just a surgical problem. It turns into a surgical, but then subsequently a medical problem, and we can come up with different drugs that help us diagnose and treat these complicated tumors. What's most rewarding for me is when a patient has that perfect result, when they can go on with their lives, 3 months later or whenever they're fully recovered, they get to this point of just forgetting that they even had surgery, and they're just going about their daily lives. And then, if I'm following them every year or every 2 years or whatever, then once in a while they'll get this reminder in their My Chart or whatever, telling them, hey, you've got to go see Dr. Patel. But it's almost, they've gotten to this point where they forget that I, ever did anything for them. And that's what I want. I want to be able to make an impact for them. But at the end of the day, as they go on through their lives, they're not reminded on a daily basis about this problem that they used to have.